Hey, everyone! Welcome back to the channel. I'm Myada, and on this channel, we dive deep into scientific research and its impact on global health. Today, we're exploring a pressing issue that's affecting all of us, climate change, and how it's driving the rise of emerging infectious diseases. This is a big topic, so let's break it down together. As the planet warms, we're seeing more frequent and intense weather events like heat waves, floods, and hurricanes. But did you know that climate change is also influencing where, when, and how diseases spread? From malaria to Zika to new viral threats, the link between climate and infectious diseases is more crucial than ever. Let's dive into the science. So, how exactly is climate change contributing to the rise of infectious diseases? It's a complex process, but a key factor is how rising temperatures and changing ecosystems are altering the habitats of disease vectors like mosquitoes, ticks, and other carriers of infectious diseases. For example, mosquitoes, which transmit diseases like malaria, dengue, and Zika, thrive in warm and humid environments. As temperatures rise, these mosquitoes are moving into new areas, bringing diseases with them. This is especially concerning for regions that have never had to deal with these diseases before. And it's not just mosquitoes. Tick-borne diseases like Lyme disease are also spreading into new territories as warmer winters allow ticks to survive in previously colder climates. This creates a perfect storm for infectious diseases to emerge in places that have little immunity or public health infrastructure to handle them. Researchers are mapping out how diseases like malaria are shifting due to climate change. What's alarming is that millions of people who previously lived in low-risk areas are now at higher risk of infection. It's a global health crisis in making. So, what does the research tell us? Let's talk about some cutting-edge studies that are helping us understand this connection between climate change and emerging infectious diseases. Researchers are using sophisticated climate models to predict future outbreaks. By combining data on temperature, humidity, and rainfall with disease spread patterns, scientists can forecast where the next outbreaks are likely to occur. This is especially useful for governments and health organizations to prepare early warning systems and interventions. But it's not just about prediction. Field research is also crucial. Scientists are monitoring changes in animal and insect populations, studying how these creatures adapt to new environments, and tracking how diseases spread in these ecosystems. This work helps us understand which species are most likely to carry and spread infections under changing climate conditions. Another area of focus is zoonotic diseases. These are diseases that jump from animals to humans. As climate change forces wildlife into closer contact with human populations, the risk of zoonotic diseases increases. Think of outbreaks like Ebola, SARS, and even COVID-19. These are examples of how environmental disruption can lead to the emergence of deadly diseases. Deforestation and habitat destruction are major drivers here. When animals are displaced from their natural habitats, they come into closer contact with humans, increasing the chances of disease transmission. And this isn't limited to remote areas. Urbanization is also playing a role in bringing wildlife closer to cities. So, what can we do to mitigate these risks? Well, global cooperation is key. Scientists are calling for stronger collaboration between climate experts, epidemiologists, and public health officials. By working together, we can develop strategies to adapt to climate change and reduce the spread of infectious diseases. Some of the most promising solutions include strengthening global disease surveillance systems, developing vaccines for emerging diseases, and investing in climate-resilient healthcare infrastructure. At the local level, educating communities about the risks of climate-driven diseases and promoting prevention measures are crucial steps. Climate change and emerging infectious diseases are deeply interconnected. While the challenges are immense, scientific research is helping us prepare for and prevent future outbreaks. As individuals, staying informed and advocating for climate action is something we can all do to make a difference. And that's it for today's video. If you found this content helpful, make sure to give it a thumbs up and hit that subscribe button for more deep dives into health and science research. Let me know in the comments what topics you'd like to see next. Until then, stay safe and stay informed. Thanks for watching.